Hello and welcome to our viewing audience to the third in a series of national conversations regarding climate, clean air, health equity, and inequity. Our host today is Moms Clean Air Force. Moms Clean Air Force is a national organization of parents and caregivers who are focused on protecting clean air and children's health. Moms is committed to exposing environmental justice in Black and Brown communities and exposing health inequities affecting BIPOC or Black, Indigenous, and people of color communities, as well as rural communities and those suffering from medical conditions. This year, Moms is amplifying the connection between climate and health equity. We are bringing together community organizers, healthcare providers, and elected officials to help people to understand the importance of identifying solutions that address the connection between climate and health equities, and sharing experiences on addressing how parents and caregivers can engage with lawmakers and healthcare experts to demand stronger protections from air pollution and climate change. And now I would like to introduce you to Ms. Oliver, who's going to provide our land acknowledgement. Ms. Oliver.
Thank you, Almeida. Yes, as moms and with Moms Clean Air Force, we are encourage all to give land acknowledgement. Moms Clean Air Force acknowledged we stand on the ancestral lands of over 574 First Nation tribes of the United States, the original caretakers of their ancestral lands, and we acknowledge the historic trauma that has been inflicted on First Nation tribes of the Americas through unjust laws, policies, and regulations. It is important we address the environmental injustices that have been inflicted on the First Nation tribes and that we have Indigenous inclusion when addressing the climate crisis. I am Shaina Oliver, and I'm a state coordinator for Moms Clean Air Force Colorado chapter, and I stand directly on the ancestral lands of the Cheyenne, Ute, and Arapaho, and as well 45 tribal First Nations of Colorado. Importantly, I'm a mother of 4 children, and we are the descendants of the genocide known as the Indian Removal Act, known to the Diné as the Long Walk of the Navajo. And thank you for allowing me to do the land acknowledgement, and I will hand it back off.
I appreciate it. Thank you, Ms. Oliver. Now I would like to introduce the remainder of our panel. In addition to Ms. Oliver, who has, as she's indicated, is the state coordinator for Moms Clean Air Force, and she's also an advocate for Indigenous people's rights. Next, we have Dr. Lori Byron. Dr. Byron is a pediatrician and organizer for the American Academy of Pediatrics Chapter Climate Advocates. And third, we have Mr. Caleb Minthorn. Mr. Minthorn is from the Umatilla tribes, the National Tribal Association, Region 10 alternate, and he's also a member of the Executive Committee of the National Tribal Association, or NTAA. I ask you, the audience, to learn more about our impressive panel by going to momscleanairforce.org and reading their entire bios. Now, I would like to tell you more about our intention today. And also, I forgot to introduce myself. I'm Almita Cooper. I'll be your moderator. I'm the National Manager for Health Equity for Moms Clean Air Force. Our intention today is to help our audience better understand the human connection between clean air, climate, health equity, and inequity, with special emphasis on Indigenous and tribal communities. Because language matters, we are going to use the term Indigenous to refer to the descendants of the inhabitants of North America before 1492. I also would like you to be aware that in the United States, there are about 2.5 to 6 million Indigenous people, and of this number, about 20% live on tribal lands or in Alaska Native villages. Climate change is a significant threat to the health of Indigenous and tribal communities, especially to mothers and their children. I'd also like you to consider some of the following facts as we engage in our conversation today. Indigenous communities are disproportionately affected by pipelines, mines, waste incinerators, and other polluting industries that poison the air and water. For example, in New Mexico, the Navajo Nation, which sits in San Juan County, received an F again this year from the American Lung Association in their State of the Air report. Generations of systemic abuses of Indigenous people has led in many places to chronic poverty, poor health care, substandard housing, and inadequate protection from sources of pollution. Indigenous adults and children have higher rates of many diseases, particularly diabetes, asthma, heart disease, and chronic obstructive pulmonary disorder, or COPD. An analysis of population data and oil and gas facility information for 3 tribal groups showed that Indigenous people are far more likely to live within a half mile of oil and gas facilities compared to the total population of the states where they are located. And the 3 communities that were identified in this study were at Fort Berthold Indian Reservation in North Dakota, the Navajo Nation in Utah and New Mexico, and the Uintah Ure peoples, who are our Northern Utes in Utah. The life expectancy of Indigenous people is 5 years shorter than for other Americans. Indigenous people die at higher rates from a range of causes, including liver disease, diabetes, and respiratory diseases. And health disparities are rampant and reflect centuries of genocide, persecution, discrimination, and neglect. And in addition to these facts, I also just want to share that impacts from climate change on extreme weather and climate-related events, air quality, and the transmission of disease through insects and pests, food and water increasingly threaten the health and well-being of American people, particularly populations that are most vulnerable. So now what I would like to do is turn our conversation to share with the audience some of the reasons that our panelists have been drawn to environmental justice and issues involving health equity. And I would like to first welcome Dr. Byron, and she's just going to briefly talk with us about her areas of passion and why she's involved in this work. Dr. Byron.
Thank you, Ms. Cooper. I'm honored to be here. I have to start with a story. We had a flood at the Bighorn River in my community in 2010. It was one of those 100-year extreme weather events. The interstate and the community and the hospital flooded. It made national news for a couple of days. And then the water subsided. And for a traveler driving down the interstate that splits the reservation where I worked, things looked fine, normal. But on the ground, in the community, things were not normal. There were families who had been just getting by before the flood, and then they lost all their clothing, or all their drywall was destroyed, or their car was destroyed and they couldn't get to work. And it was just too much. And some of these people just couldn't get back on their feet. And years later, things were still not normal. Some people were still living in FEMA trailers, or an entire family was sharing a spare bedroom with a relative, and some people were still homeless. So besides the 25 years living in this community before the flood, that event solidified for my husband and I just how unfair this whole climate change process is. It's just one more huge injustice for the people that we worked with. And in such a remote area, we have less resources, less money, less services already. And many of our parents work outside, and that's another risk factor in a world changed by climate. That was the beginning of our getting involved in climate work.
Thank you, Dr. Byron. And now I'd like to ask Ms. Oliver if you would share with us what brought you to this important work.
I say, as a tribal member of the Navajo Nation and growing up from and experiencing the reservation and experience living in the urban city area of Denver, Colorado, that it really has drawn me to environmental work, especially in 2016 when the gold mine spilled happened into the Animas and San Juan River of southern Colorado, and a lot of our water that filters from Colorado into our neighboring states like New Mexico, Utah, and Arizona, Nevada, California, and on way to Mexico. That many tribes, over 24 tribes, are impacted by the water that was contaminated through that gold mine spill. And it really opened my eyes about how my tribe, the Navajo tribe, is really impacted by what goes on in Colorado. And now that I live in Colorado, I see the environmental injustices from the reservation, from the Navajo reservation to the places in Colorado where there's a lot of environmental injustices that are happening, especially for people of color, and especially working families. And it has really shifted and shaped where we live and where we're told to live, and how it has shaped our history historically through environmental injustice policies like the Indian Removal Act. And I see that through the policies, laws, and regulations that have really impacted our lives as people of color, and has really impacted our communities that we live in, because we're particularly forced to live near polluting industries. We're forced to live near and on Superfund sites. We're forced to live near highways as well. And on the reservation, we experienced the extractive capitalism of coal, uranium, oil, and gas. And we see that continue to be the same song and dance for people of color, especially Indigenous communities, as well as our Black and African American communities across the United States that are placed where our communities are placed right next to industries like Suncor Refinery here in Commerce City, Colorado, which is just north of Denver, and industries like the coal plants and gas plants that we have that are much closer to our communities, and where our affordable housings are placed. It has really shaped me to take more action in sticking up as a mom of 4, and as well as being impacted by the health impacts. And that's one of the number one things we don't talk about or told about, that our health will be impacted by these environmental inflictions from living near industries like Suncor Refinery or gas plants like the Cherokee gas plants here. And across New Mexico, there's quite a few gas plants in the state of New Mexico, as well as many other communities across the United States. But what we continue to see is that working families, people of color, particularly Black and Brown, are placed next to these industries. And we're not told about the health impacts that inflict on us. And as Indigenous people, we're much higher inflicted with asthma, heart disease, cancer, leukemia, mental health, adverse birth outcomes, and premature deaths than any other general population. And I myself have asthma and been diagnosed with asthma since infancy, as well as my youngest son is now confirmed that he has asthma. And we have to be more careful with ourselves, especially during the high ozone days here in Colorado, and which we're now the 7th worst state for poor air quality for ozone standards and limits. And it continues to be that way because of these environmental injustices that we're not seeing enough change in these policies and regulations and laws to actually protect people's health. So that's why I continue to advocate for not just for Indigenous people's rights, but for all children's right to breathe clean air and to be able to play in clean water and to be able to play on the soil and playgrounds without, we shouldn't have to worry about where they're playing. So thank you, Almeda.
Yes, thank you for sharing your experiences with us. And last, let me just ask Mr. Minthorn if he will share with us some of his reasons for the brings him to this important work?
I'll try and keep my answers brief. The first reason, well, I'm a father also. So as a concerned parent, I definitely would like to spread some awareness and share my knowledge on what I know about climate change and how we as human beings and, the global community itself drive climate change in different ways, but we're also, we're taking the brunt of it, right on the front line here, in Indian country. And so to speak to what Ms. Oliver was talking about, where I'm from, we actually live in an ozone corridor, and in the state of Oregon and Washington, every summer it approaches the national standard, sometimes crosses the national standard of 70 parts per billion set by the EPA. And so that's just from my experience as a technician working with ozone monitoring. And as the summers get hotter and these wildfires keep getting larger, I don't foresee the ozone decreasing. And so it's I take it upon myself to help speak for those that cannot speak for themselves, and that being the animals, the plants, the water, and on my side, the air, of course. And so without getting too much into what we do and who we are, I'll kind of stop right there for now.
Thank you so much. Let me now direct a question to you, Dr. Byron. You began your work in climate-related public health advocacy after working with Native American children and families for the last 3 decades. How did working with this demographic change your strategy or your approach to your practice and to your advocacy?
Thank you again, Ms. Cooper. So my husband and I were blessed to spend 50 combined years on the Crow Indian Reservation, both learning a lot from and teaching and treating the people there. And while working for Indian Health Service, which is a branch of public health, advocacy came naturally. We were taking care of individual patients in the exam rooms, but we were also frequently using a systems approach, working with the community and lots of other kinds of healthcare people doing public health work. So if there were a lot of car wrecks, why was this happening? And what could we do to lessen the problem? And some of these problems lent themselves to political advocacy, like passing legislation with the tribe or the state on seatbelts. Or for some problems, it was helpful to talk to governmental agencies, like with the transportation people, on how we could make our roads safer to lessen those car wrecks. So my husband and I had done this public health work for decades when we really became aware of climate change and its effect on humans a little over a decade ago. And we came to believe what the experts said, that we would lose decades worth of health improvement gained by public health if we didn't address the climate crisis. And because we were working amongst people that had such strong connections to nature and to tradition, I think it made us realize even more that they had even more to lose because climate was just another injustice that the dominant society had forced upon them.
Thank you, Dr. Byron. I want to turn to you, Ms. Oliver, and in your role as an advocate and in your role as a state coordinator with Moms Clean Air Force, you have regularly spoken about clean air and pollution. And you just spoke about it a few moments ago when you were explaining your passion about clean air and air pollution. And I came across a statement that you had made. Indigenous families are often systematically segregated into communities where we live next to highly polluting industries. And I wondered if you would share with us what was your thinking or what was your experience that caused you to make that statement?
I want to say here in Colorado, we've seen a lot of segregation in our communities, and especially here in northern Denver area, in metro areas, that we see that our Black and Brown community members and working families are pushed to North Denver. And particularly these areas are surrounded with industrial sites like Suncor, like the gas plants, like the recycling waste sites, as well as other waste sites that have been designated in this particular area of North Denver, which is now Commerce City, Colorado. And the name itself kind of speaks for all. Commerce City is where all these industries are allowed to pollute. They're actually allowed to pollute into the water as well. And the further as cost of living keeps going up here in Colorado, a lot more than many other states, that our working families have been pushed to Commerce City. Currently, I'm displaced because I am not willing to live in this area that I know my house will be deteriorated once I live in that area. And through my advocacy, working on environmental justice and advocating for climate justice, we've seen that there is a dramatic pull of working families living in this area, and that particularly white counterpart communities are further south and don't see these same environmental harms that our families see. And the more that we get gentrified, we're being pushed to live into direct impacted communities of environmental harms, like living next to Suncor Refinery. Like my friend Lucy Molina, she lives just up the road from Suncor Refinery, and she's a working mom of, she has 2 kids, and many of the cases in this community that we canvassed in this area have been, they are being impacted health-wise. Doing the footwork in these communities, you will learn that people are being harmed. Canvassing in this area through experience for our Eco Festa that we had last year, I was able to learn more about the community, and through my advocacy of celebrating Latino leadership in some of the legislation that we have got passed through, from air toxics to regulate air toxics here in the state of Colorado, has really got me to learn that community members are suffering from heart disease. They're suffering from cancer, brain cancer, prostate cancer, as well as fathers are becoming widows in this community. They lost their wife, they lost their son in this community. And these are working families. These are still human beings that live in this area and are being impacted by these environmental harms, because we have a system that allows procedural loopholes for industries like Suncor to be allowed to emit those toxic, harmful substances that impact our health and impact people's families that live in these communities. This community can't even use their water for drinking or cooking. And the state Department of Public Health and Environment is very well aware that people are not using their water for drinking or cooking. So these loopholes that we base policies and regulations, we need to do more in actually protecting public health. And here in Colorado, we've really pushed hard for regulating air toxics, because there's a lot of chemicals that are being emitted from these industries that are not, we're not told about them. They're not being regulated. There is no limitations currently for a lot of these toxic air contaminants that enter our air in our communities across Colorado and beyond. We don't know the research behind that, but once we have the legislation to actually start regulating air toxics, like the state of Colorado, we just passed our protections against toxic air contaminants, 1244. And I am grateful that we're actually going to start regulating these air toxics and how they're actually impacting community members across the state of Colorado. And hopefully we see that we want to see the EPA follow in these steps in actually mitigating protections on public health in these communities. And that's why I think it's a responsibility as a mom that we protect our health as well as our children's health. And that's why we continue to do this work, because our health is not being protected as much as these industries have been protected. So we wanted to bring that equity to not just our community, but a lot of the communities that are suffering like ours.
Ms. Oliver, I think that makes a perfect lead into a question that I want to ask Mr. Minthorn, because you spoke quite a bit about air pollution. And many of our viewers may not be familiar with the National Tribal Air Association, Mr. Minthorn, and I wondered if you could just speak about what the association does and perhaps some facts that you would like our general audience to know more about the NTAA, especially about your annual report.
Absolutely. The National Tribal Air Association was founded in 2002, and it was founded and funded through a grant from the EPA's Office of Air and Radiation, and they have a mission statement to advance air quality management policies, programs consistent with the needs, interests, and unique legal status of American Indian tribes and Alaska Natives. The tribes are important partners with federal, state, local agencies to protect ambient air quality, indoor air quality, and mitigate climate change. And that's just, kind of, the broad definition of who they are. But they're, when you actually scratch below the surface, there's so much more. And now that I'm on the executive committee, I've been able to help extend some new ideas and directives, and try and give them some traction from our tribal perspective, on up. It helps deliver a message to, groups like Congress and other funding agencies on what's important to Indian tribes, and to touch on the STAR report question. What that report does is it helps provide a good picture, a good clear picture of what we need, from in terms of air programs, water programs, environmental justice programs that are still developing. And so in essence, the NTAA is like many groups, many consortiums. It's comprised of approximately 140 or so Indian tribes. However, there are a lot of Indian tribes that haven't joined yet. And so that's one thing we're trying to do is gain more exposure to what Indian tribes can offer in terms of policy change in the right direction in order to get access to more equity, to come full circle. And so without getting, too off the rails there, that's how I observe, things. And I'll toss it back to you, before I get too off the rails here.
No, thank you for sharing that information with us. I want to just quickly, in the remaining time, I do have a question for you, Dr. Byron. I think it would be very helpful to our audience. And, the information that you have shared and the work that you have done as a physician and pediatrician, some of the environmental factors that affect your patients, it's just incredibly important, but it's also a bit scary. And I wonder how you have been able to communicate this type of information to your patients about the connection between environment and health in a way that is hopefully not completely pessimistic and hopeless.
Thanks. That's a really important question. First of all, I believe that patients are already pretty darn knowledgeable and they're already scared about a lot of issues, but they still want to know, just like all of us want to know. And it would be gross negligence to not tell a patient that just got diabetes that they needed to start medicine and change their lifestyle, even though it is scary news. Similarly, I think it's equally negligent to not tell a pregnant woman in the summer in Montana that the potentially upcoming wildfire smoke season is going to be a danger to them, to their unborn child, and their already born children. And like any other medical risk, I think a frank discussion of options is needed between a healthcare provider and the patient and the family. Is her home built well enough to keep out the smoke? And many lower income homes are not. The inside air is just as dirty or smoky as the outside air. Is there a family member elsewhere she could stay with for a while? Is there a clean air center in their community? There certainly isn't where I live, but there are some public buildings and there is a mall in the nearest city. So could they hang out there all day when the air is super bad? And are they aware of mental health services? These situations are times when it's a real joy to have integrated mental health in a clinic because people frequently need support. Some people have family and church, but for some, a health worker can be really beneficial. But it's also really empowering for our patients to take action, to talk to local officials, to call their senator, to write a letter to the editor. And many people have never thought of doing such actions and didn't even realize they could. And we all know that the antidote to despair is action. I think especially when outsiders like me are working in an Indigenous community or working with youth or working with less resourced people, I think it's really important to support actions that are going on locally toward problems that they want to solve. And to encourage our patients who might not be aware of these actions to get involved locally. I might personally think that a clean air center is the best thing that our community could have, but they might think that EV charging stations are better, and I need to support what they want. And I think that's strengthening to me and more strengthening to the community as a whole.
Thank you so much, Dr. Byron. And I think on that note, I would like to, because it's so important to make sure that we are listening to communities, listening to Indigenous and tribal communities, and making sure that the actions that any group is taking is responsive to what the community wants. And on that note, you covered, I think, part of the call to action, Dr. Byron, in your answer, but I also want to give first Mr. Minthorn and then Ms. Oliver a chance as we close out to say what important message you would like to leave with our audience today. Mr. Minthorn?
The number one important message I would like to leave with the audience today is that climate change is not new to Indigenous communities around the world, not just here in the United States, and that we have the knowledge to continue to fight climate change in the right direction, but it's locked away in our languages. And if we don't preserve those languages and bring them out, we're going to lose a lot of knowledge, and therefore the fight against climate change is going to be a lot more difficult, which it already is. But not to worry and not to give up, because if those people before us didn't continue to fight climate change 200, 300, 400 years ago, we wouldn't have a fighting chance today. And so the battle's not over. It's it's really just getting started with these wildfires and earthquakes, and it's flooding here or in Oregon, Washington. Our landscape is changing right in front of my very eyes. So, that's what I would like to say, is that this isn't our first go around with climate change, and it won't be our last. So if we can just preserve the knowledge that our ancestors were handed to them, we'll be able to provide a tomorrow for our children, and that's about as simple as it gets.
Thank you, Mr. Minthorn. And now, Ms. Oliver, as a mom and a member of Moms Clean Air Force, what top line message would you like to leave with our audience today, briefly?
Yes, I think the importance of it as a mom is to really just advocate, speak to senators, speak to Congress. Even as an Indigenous tribal member, we should speak to those leaders and re-advocate and reclaim our rights as Indigenous people, reclaim our ancestral lands, protecting traditional ecological knowledge, making sure that our elders are being listened to in our Indigenous communities, because if we're going to address the climate crisis, we need to have Indigenous inclusion, and we need to preserve our language, preserve our culture, and to not be afraid to speak up on these issues, because we need to stand up for the next 7 generations. It's the next 7 generations that we're not going to see. They're going to have to, they're going to be taking the burden. And it's really important as parents that we speak up for the children that don't have a seat at the table. They're not at these decision meetings. And that's why I speak up on these issues, because for the same reason as Caleb has mentioned, is that we need to preserve these things. And if we don't, we're going to lose it. So right now, what's really important is for our youth and our parents and community members to really advocate for reimagining our communities, to where we need to advocate to our senators that are on the Board of Education. We need to reimagine the way we educate, because when education was brought to Native Americans, it was brought to kill the Indian and save the man. But we need Indigenous inclusion. We need Indigenous inclusion when it comes to educating, when it comes to our health and nutrition. We need food sovereignty. We need those things. We need Indigenous knowledge to be incorporated in our communities and in our governance. And I feel strongly about that. And that's why I continue to advocate for Indigenous people's rights, because we need to reimagine those jobs. We need to reimagine what makes our homes our home. And we need to reimagine what it means to be community and to have that Indigenous inclusion in there, so that we can continue to grow from this. So yes, thank you.
Thank you. And I want to say to each of you, thank you so much for sharing your personal thoughts, your passion, and your insightful comments about how we can better serve Indigenous and tribal communities as it relates to improving clean air and climate and addressing some of the health inequities that exist. But simply learning more about these issues is not enough. I want to say to our audience, don't stop here. Make sure that you engage with your local officials, both at the local level, the state level, and the federal level, and also reach out to Moms Clean Air Force at our website, momscleanairforce.org, and be involved and stay engaged. I also want to invite you to join us in our next conversation, which will be aired in July of 2022. We will be addressing the topic of extreme heat and how it affects the quality of life of Latino outdoor workers. And again, thank you to our panel members for your insightful comments. And I look forward to hearing more about the work that each of you are doing. And I'm sure our audience appreciates hearing from you today.